Well, now the current situation is, let's say, the stability, effectivity, and problems. For instance, the deaths that happened last night were the highest number ever. We are keeping in the last 5 days over 800 deaths per day. Last night was 848, which is a lot. And we have already over 100,000 people confirmed as contaminated and with the disease, which is obviously a extremely high number. The high number is the problem because this has happened all of a sudden. Even that the healthcare system in Spain is good, nobody could be expected that this could be like in a war, that you receive a lot of casualties at once, and even that you have a healthcare system which is prepared for attending the normal population. This is an emergency. It's a constant emergency problem in which many people, especially the elderly, are very soon sick and they develop severe forms of the disease and they need to be hospitalized, very soon assisted in the breathing by machines, and later on to be in the intensive care units, which is the problem. They collapse the intensive care units, and these units are at this moment with an overload of patients, an overload of responsibility with all the personnel of the hospitals dedicated to this problem that makes even other problems of assistance to the people to be not abandoned, but with less attendance than before. So the global healthcare system is at this moment under almost collapse. It's not collapse, but it's there. And definitely the authorities, which is the second part of your question, are doing whatever they can. You know, nobody was expecting even that the World Health Organization has offered to them instructions in late January and middle of February about what was going to happen, what was coming. Nobody was expecting to happen in that high level. The reason for this is that the government didn't take the adequate measures in the convenient moment, and that allowed the dissemination of the disease related basically to political actions that make the people to gather in the big cities with a huge potential of contamination. And this contamination was spread out in the cities, especially in the big cities, which became, as Madrid and Barcelona, very early infected with a very high number of people in about 15 days, which makes the initial collapse. Second collapse came because of the people that was contaminated by these ones, and this is now happening. And probably we are now in the plateau in which the contaminations are becoming stable, not increasing in number. The deaths are stable, not increasing, but not decreasing either in number, and that's the condition. So the authorities are responding with what they have. They were late in the response, they were inadequate in the preparation, and they didn't have the supplies and the care for having the supplies in time. So they are in part guilty of this problem, but obviously everybody was surprised by this severity, by the frequency of the infections and the frequency of the severe cases. That is related basically to the age of the population, which in Spain, because life expectancy is high, is very high. In Spain, we have a life expectancy now over 90 years of age. Yeah, ophthalmologists have been serving the healthcare from the beginning, you know, because as so many people became sick so quickly, the young doctors, the young residents who have been recently in the medical schools, they are fully prepared to attend these people on the emergency departments and to supervise and to attend the immediate care of many of these people. So residents were very quickly taken to the intensive care units and to the units in which they were attending the patients that were hospitalized immediately that they were received with severe symptoms. And the eye care has been, from that point, a secondary issue. These patients with the COVID-19, we have to know that about 20% of them have a conjunctivitis. This was identified by the Chinese investigators very, very early. It affects about 20 to 30%. And those people with conjunctivitis are capable to transmit the virus through the tears. It is transmit the virus through the tears, but those that have conjunctivitis, all of them can transmit the virus through the tears. This is important to know. So ophthalmologists have made aware of everybody in the emergency departments that have to protect their hands, their eyes with goggles. And these goggles have been especially useful in patients that had the suspicion of the virus with the initial development of conjunctivitis. Conjunctivitis can be also a secondary issue happening between the 7th and the 10th day of the infection and the symptoms. And in this level, the patients are still with potential for infecting others through the tears. So the ophthalmologists have been taken out from the ophthalmology departments to the intensive care units, to the emergency departments especially, and about 1/4 of the ophthalmologists now are in the task force to stop the disease at the very beginning. Ophthalmology services are at this moment reduced to just basic emergencies, justified cases, and intravitreal injections in justified protocols. So we have reduced activity to about marginal, less than 10% definitely. Doesn't mean that the ophthalmologists are not busy, they are busy, but busy with the general hospitals, attending the people in the emergency departments, in the different places where these people are hospitalized at this moment, improvised hospitals, and they are paying attention and paying particular care to these patients at this moment. Telemedicine at this moment is informative. We are informing to the people that those with conjunctivitis to take special care not to touch their eyes and not to touch with their hands anybody. And the ophthalmologists and the people at the emergency departments should use special goggles to prevent the people to have the virus as a potential infection through the tears and through the conjunctiva, because in this Chinese investigation has been demonstrated that the conjunctiva can be the door of entrance of the virus, because receptors exist there for the capability for this virus to enter into the cells and to disseminate later on. Well, that's very important, because this is our responsibility. When we didn't have any particular protection, we were using alcohol gels in order to clean our hands. We are using a mask, which seems to be important but not essential. The main issue is to have the hands clean, to have the hands with gloves, to have the hands with protection. Second issue is not to touch your face with your hands, and especially not to touch with your hand your eye. These are the three issues: hands contact with the face avoided totally, and hands contact with the eyes totally avoided. And if you have to do that, for instance, to use drops or to check the intraocular pressure, then you have to change your gloves or to use immediately after the alcohol gels in order to eliminate from your gloves the potential infectious agent. Second is to protect in the sleep lamp with the adequate plastic protectors your face. So we have a face-to-face contact with the patient. With this type of seals, transparent seals, we have a shield to protect ourselves from the patient, and the patient can be protected by you as well. We are using masks at the same time. The patient is using masks, and we are using goggles in order to protect our eyes as well. So these are the basic elements. We use the drops ourselves. We don't make the nurses or other people to put the drops into the eyes of the patients, because we want to be sure that all these measures are taken professionally into the protection of the patient and yourself. And we try to reduce the contacts with patients, isolating them 2 meters apart, one from the other. We don't allow the patients to have relatives at the moment of their exam in the office, and we are in the office alone, unless we need an assistant, the nurse, or an auxiliary person in order to assist us, just to open the eye to check the intraocular pressure or to make any particular maneuver in which we need help. About the operating room, the rules are the same. The only difference with a normal operating room attire is that we are using goggles as well. Goggles in order to protect ourselves from the microscopes, even that they should be sterile. And again, to have extreme care with your hands, not to touch your eye and not to touch your face at all. And this is a very important issue. We perform binocular ophthalmoscopy rather than direct ophthalmoscopy. Indeed, this is much more adequate for the patients and for us. And about other measures are just the normal ones that you have to take with every patient. We are using gauze. These gauze are changed from time to time in order to be clean and not to have any contact with anything that brings the patients. And basically, these are the measures. All the materials and substances and medical devices that we use are thrown away or immediately referralized, which makes an important burden to the hospital because we need to have a lot of cones for the tonometers or the non-contacts. We have to use specific instruments that avoid the contamination patient to patient or patient to doctor.